don't know where, and it like brought it up. Then that's the other part.
What?
Sure, nothing.
Yeah, she told me that she was gonna try to make it.
I know I can get over there.
Hmm. Liz and Sandra, y'all are not in your spot.
Oh, I thought we could trade up to the next week.
Nope,
Oh,
we still are COVID active. Gotta be in your spot.
you stood over there yesterday.
Oh, I didn't know she could change spots. Yeah, y'all gotta stay where you are, because I gotta be able to, I've got you in my system where you are. That way if someone gets exposed and I get a text at home saying, hey, I'm positive, and I can text you and say, guess what, you were exposed. So, sorry. Thank you. Okay, it's 9 o'clock. So today what we're gonna do is we're gonna look at your actual module, okay? So that way we can go over exactly what you have to do. I still don't have all the due dates in just because all of you guys have different due dates for each assignment, so it just takes me a little bit to change the due dates, okay? So I started working on that yesterday afternoon, and I will finish hopefully today with those. So I'm actually
Proud of us that we're trying to be proactive.
I am. I'm so proud of you guys already panicking over an in-class assignment.
Well, you know what? Better than not even knowing about it.
I agree. I totally agree. So let's look at that first. So I know that Lucid showed me that it doesn't have the exact name, but I was just going to show you. That one was one that Janessa put up for her lecture she's going to do with you guys. She's going to do it today, but she's here, but she's going to wait till tomorrow till she's 100. Well, I told her, I said, really, you're only going to be about 90% because you're pregnant, so you're never 100%. So on mine, when you open them with you guys, it's been fine. I always try to go ahead and put like the directions just in case if it's not in your calendar on ATI, then you can actually look at the directions, and I'm going to tell you how to find that assignment that I want you to do, okay? Because I don't know, I usually assign it in ATI on my end, and if it doesn't show up in your calendar, I don't know why. It's an ATI issue. I've emailed them every time to say, hey, I made an assignment calendar. The students can't see it on the calendar again, and they've never really told me why.
That one's on the calendar.
Yes, this one, and so I don't think she may not have made the assignment. So what I'll do this afternoon, is I'll go in and put it to open tomorrow in class, so it'll show it.
This assignment is locked until January 26th at 12.
Yeah, she'll open it for tomorrow. Okay. So back to modules, which mine looks pretty similar to yours, just a little bit different. So we're going to look first at the hospital. So when you open your hospital module, you have some instructions, okay? You're going to be assigned to a different location each day of your experience at the hospital. On Thursdays, it will be Shayla, and for now until who knows when, it will be me on Fridays, okay? We are to meet in the front lobby at the hospital by 6:30, okay, ready to receive your assignment. The first few days that you're on the medical surgical floor, we're going to assign you a patient, okay? And then after that, couple weeks, we may just assign you a nurse, and then where you will shadow that nurse, be with that nurse, but you will need to choose one of the patients you're assisting with to do your assignment over, okay? That gives you the opportunity to try to do more than one patient kind of care at a time. Or you're seeing it now, not just from one-on-one patient to nurse care, but kind of how does the nurse handle juggling of more than one patient, okay? Does that make sense? So for each unit that you're gonna be in, so you could either be on med-surg or ICU. And so with our ICU, we do some drips and some critical things. We do have some people who are vented, but it's not as critical as like a cardiac ICU. So I feel like it would be a good experience for you guys to have the opportunity to be on the ICU unit and kind of see just a little bit more of that criticalness that you would see in level 2, but also still kind of get to do some of those med-surg type things. So you'll go to the nurse's station. If you're on med-surg or the ICU, you want to introduce yourself to the charge nurse. If you have an assigned patient, find out who the nurse is. If you have an assigned nurse, find the nurse, okay? Last semester, you got to go to the library and research prior to going up and being with your patient and nurse. This semester, you're going to go up and receive report with your nurse from the off-going nurse, okay? So you're going to see how that process is. And then you're going to see how it is to go from the beginning of shift. Like, they don't get to go prep 2 hours ahead. Nobody wants to go prep 2 hours ahead. So you have to start your shift with new patients and go from there. So you guys are going to see it from that perspective. But again, after we get done at the end of the day, if there's some content or stuff you are not able to get during your time on the floor, you have access to the library to go ahead and get out any other information from the chart that you need for either your concept map or your shortened case or your shortened care plan, okay? And please remember, while you're on the floor, yes, the assignment is important, but what's most important is you getting that one-on-one hands-on experience, getting to practice those skills, okay? So that's the most important thing for you to be able to do while you're on the floor. When you caught up with everything, maybe your patient's eating breakfast, they're eating lunch, your nurse is busy with another patient, then go to an empty room, get on a computer, gather the information you can in that 5 to 10 minutes. Don't be gone away from your nurse more than about 10 to 15 minutes at a time, because then something's going to happen with your patient. You're going to have missed out on an opportunity to do a skill, okay? OB, so you'll actually go to the floor and kind of just be one-on-one with the nurse. And then what I want you guys to focus on, we're focusing on postpartum newborn, okay, this semester. So more times than not, we have more postpartum newborn, so we do really labor. So you should have the opportunity to get that assignment done. And we're going to look at all these assignments. ER, you're going to be same thing with a nurse, okay, because their patients come in and go out. They go home, sometimes they go to the floor, sometimes they get transferred to a different unit, okay? And so for your assignment, you're going to pick one of those patients you see through the day to do your assignment on, okay? So when you go down here to the bottom, here is a draft of where you'll be, okay? So, Brecklin, Angela's not here and I can't pick on her. If you go to, on your first day, you should be in ICU, your second day, you should be ICU, okay? So one day you may want to do the shortened care plan. If you have the same patients the next day, then do the concept map. If you have a new patient, then you can pick, okay? In the next week, you'll be an OB. The PO, remember, is that perioperative. We're going to go over that assignment in a minute. MS, Med-Surg, ER, okay? So there are your 8 days that you have on your clinical schedule. Now, again, remember, based upon patient volume, you may have to be switched around somewhere, okay? So if you go in and you're scheduled to be on OB and they have no patients, which never happens, then you might have to go to Med-Surg that day and we'll switch the days. And Shayla, if Shayla's there, she'll let me know. If I'm there, I will make a note and we will flip flop, okay? But this way, when you go in, you know what where you're gonna be, okay? So you know what to print if you wanna print. That way you're kind of expecting, okay? Can everybody make sense of this chart? Okay.
Don't have clinicals at all.
Well, you may have clinical somewhere else. This is just for the hospital. Yeah, this is just for your hospital assignment, okay? Okay, so say I'm in the ER today. I'm going to open my ER clinical experience, and here I have my clinical objectives. Every week, not 2 times a week, but just once a week, you have a clinical reflection that's due by Monday, okay? It's just a short little couple paragraphs. You tell me how your 2 days of clinicals went, new experiences you got to do, how was the staff, did you get to do one-on-one with the physician, did you follow the charge nurse, did you do charge nurse stuff, you know, what did you do, okay? You don't have to do one for each day, you do one for both days, okay? I'm trying to condense your work, okay? Then you have your ER clinical assignment. When you click on it, it's going to bring you to your assignment, okay? Again, it has your objectives. So prior to the ER experience, you have a video I want you to watch, kind of tells you how to do a quick assessment in the ER, because it's different than on the Med-Surg floor, okay? It's more of a focused assessment initially, and then you go on to the more, the other parts of the body. So then it talks about after your ER rotation, you basically are going to write a small paper for me. Doesn't have to be more than a page, okay? You have some criteria that you need to give me, like what patient did you see? What demographic did they come from? What assessment data did you use? So did you do a chest x-ray? Did you do a CT scan? What did the doctor order so we can find out what's wrong with this patient, okay? Lab values, diagnostic tests, anything that was performed during that ER time, okay? And then I have not added it yet, but I'm gonna put one medication sheet up from ATI. And I know you're doing your meds and pharmacology, but I want you to look at the medications that might have been administered and tell me something about one of the medications. Okay, so you're going to basically kind of do like a med card. And you know, when you're talking to your nurse, you might ask, hey, which one of these medications do we give often? Which is one medication that we see people receive when they come in for this often? So that way, when you're looking at that med list, if they got 10 medicines while they're in the ER that day, you can choose one that you probably should know, okay? You're going to describe what the role of the ER nurse is, okay? There's some questions to answer, and this assignment is due 4 days after your last ER rotation. I actually think I may have changed it. So I'm going to do all of your assignments for like your care plans and stuff will be due Wednesday by 3. A few of these assignments like this one will actually not be due 4 days. It will be due the following Friday by 3. Okay, I'm giving you some extended times. Okay, so disregard that. I'll have to change it. Actually, I'm in me, so let me change that. It'll be 7 days.
Like the little girl would say.
Right? From southeastern Oklahoma. So here again is for the paper, your directions. I also, and it has the rubric of what I'm gonna grade on. Here is the actual document in Word, so that way you can open it, and if you want to, you know, do it under it, okay? So that's your ER. Okay, so we're gonna go back to modules. Open back up our Southwest Med. So Med Surge, you'll click on your Med Surge page. So it's gonna open up to tell you what are your clinical objectives. Here are your assignments, okay? So you're gonna have 5 potential submissions to for your clinical experience, okay? If say something happens and you only get to go to MedSurg 4 times because you had to switch and do another area, then it's going to be fine. It'll all work out in the end, okay? There may be sometimes you have to go to the ER twice. Then I'm going to give you a modified assignment, okay? If it's Shayla that's there and you tell Shayla I've already been there once, but I can go back, just make sure you send me a text or an email that day and let me know, hey, Amanda, I'm doing a second day in ER and it's not going to be a hard assignment. It'll be very simple and I will shoot you a new assignment to complete to replace that med search day because you've got it. I want you to have the equal amount of points as everybody else. Okay. I'm all about flexibility. The other thing is, again, I have a reminder on here. Don't forget to complete your clinical reflection. Okay. So on your clinical reflections, that will be the only thing that will not have a due date. Okay. Because I can't really date them for you. So you just have to remember every week, okay, I have a clinical reflection due. I have a clinical reflection due. Okay. So after your clinical experience on Friday, go on there and fill out your clinical reflection so you don't forget by Monday. Okay. So that way, you know, that's the only ones that I won't be able to put due dates on, just in case things change. So back to modules. So for OB, you have a page also. Gives you your clinical objectives for the OB department. There are some videos on here to help you refresh your memory on how to do a postpartum assessment, how to score for APGAR scoring, and then how to do a newborn assessment. Okay, so those are just refreshers for you, just in case like your OB is not until April. Okay, you're like, oh my gosh, we haven't done OB since January. So these little videos are on there to kind of help remind you of the steps that you would take. I'm also going to go on here this afternoon and add on a couple little supplemental things. It's kind of like a newborn assessment, a postpartum assessment, and it's like a little checklist, okay? So that way too, while you're there, and you're like, okay, wow, what else do I do for a postpartum? Because it's different than just a normal patient. So that way, if you want to print it, you can. You don't have to, but you have a little checklist that kind of help remind you as you're doing a postpartum or newborn assessment what you need to assess besides those typical body systems, okay? So you have, again, your clinical reflection. Now your OB clinical assignment takes you to your assignment. You'll open up the link, and this is basically kind of like a modified care plan specific for OB, okay? You'll go through, you're going to fill out your DTPALs, okay? So you need to remember what those are. How are they monitored? Did they have external monitors? Did they have those internals, the fetal scalp electrode or the IUPC? Now, if there's something on here, you're like, oh my gosh, I don't remember that. Google it or ask your nurse, okay? They're not going to be like, oh, you don't remember that? They're going to be like, oh, you're a nursing student. Of course, you're not always going to know what an IUPC is. So you're just going to go through it, answer the questions, put in her labs. Now, for Dr. Knudsen's patients, his labs will be in the paper chart. They'll be in the actual chart because he does not have his computer systems not linked with the hospitals. If it's a Dr. Flores patient, they'll be in the computer, okay? If she delivers, what the delivery information is, then you're going to give us a medical history of mom. Now, this is where it's broken down, okay? Say you have a patient who's preterm labor, and that's the one you get to have that day. She's an antepartum patient, so you're going to do an assessment over her. Or she's in labor, she's an interpartum. That's your assessment there. Okay, you're not going to complete all of these, you're just going to complete one. Okay. Postpartum, there's your postpartum part. Or if your patient happens to be the newborn, now you're still going to go ahead and fill out maternal labs because that's important. We need to know that for the baby. Okay, so if you pick the baby, some of that information up there is still important to know, even on the maternal medical history, because we need to know that stuff. We put all that in baby's chart because that can determine what we need to do and assess on baby. Okay, so there's your newborn assessment. Now, cultural, psychological, and social considerations. Okay, and then just tell me what did you get to do that day? Okay, you got there that morning. Your patient was in labor. She just got an epidural, so you got to put the Foley catheter in and check a cervix. Put that down, okay? And then tell me why. Why did you do that intervention? Okay, if there's not really a good reason why, just say, I'm not sure. Or ask your nurse, okay? Because there's always usually a reason we do an intervention. Then your priority nursing diagnosis. Remember, we're not doing NANDA. This is your problems, okay? What's our 3 problems for our patient? So if it's a healthy newborn, do they have potential problems? Yeah. They have potential problems of not being a good feeder. They have a potential problems for hypothermia, because what if mom leaves that baby uncovered for 30 minutes, just oohing and eyeing over his little body, and it's 68 degrees in the room because she's hot, we run the risk of hypothermia, okay? So think of, even on a healthy mom or a healthy baby, there's still potential risks, okay? What kind of education did you provide? Did y'all do some breastfeeding teaching? Did y'all do discharge teaching and she's postpartum? Did you get to teach peri-care? Did you get to teach umbilical care, CERT care, whatever you got to help teach that day with your nurse, okay? And that's it. So it's pretty basic, okay? It's not really detailed. It's just basic information that you got to do that day. So instead of you having to write out this long essay form paper, just fill in the blanks, okay? I'm a big fill in the blank person. So does the hospital make sense to everybody?
Yes.
Okay. Yes.
On the ER one, at the bottom of the assignment, it says a medication card, and if it's not done prior to the clinical date.
Yes. Because I borrowed that from someone, so don't worry about. No, you will do it after. Okay. Yeah, you will do the medication card after, because the person, my friend of mine that I borrowed this assignment from, she had them do 5 cards prior to. Like, that's mean. And I was like, I'm not doing that. So I just, like I said, I just basically want you, because, one medication we give a lot is Zofran. Okay, so it's probably important to know what Zofran is used for. Probably important to know what interactions you can have with other common medications. And so that's why I want you to choose a medication you may be giving a lot. Phenergan, Reglan, pain medications, Dilaudid, Demerol, something like that is going to be Dilaudid given all the time in the ER. So there's an easy one, but we need to understand what that medication is used for, because if you happen to be an ER nurse, you're going to have those common things you see. So yes, I didn't make you 5. So now let's look at, so you have clinics that you're going to be at. Okay, you have the wound care clinic, you have the women's health clinic, and you have family practice. So the wound care clinic, you'll open up, there's your student learning objectives. So this is only half day, okay? So I talked to Heather, who's one of the main nurses over there, and she said Thursday afternoons is their busiest and Friday morning, okay? So instead of having you be there for 8 hours twiddling your thumbs, you're only gonna have to be there for 4 hours, okay? But because of that, we've got to make up that little bit of time. So you have some reading to do before, and then you just have some short assignments. Usually it's a video, how to do a dressing change. And then you're going to have a little assignment related to that, okay? Along with your wound care focus. So here's all of your assignments. So if you click on them, it's going to take you directly to your assignment. There's your clinical objectives again. That's your reading. And I got to take Janessa's information off. There's your clinical information. And then here is your actual assignment, okay? Again, it's more so just related to information that you're going to find in your book, okay, over wound care. And because this one is a little bit longer, it won't be due on a Wednesday, it'll be due the next Friday. So you'll have a whole week, okay? Okay. So here are your other 3 assignments. These can be done before. I would recommend doing them before, because it's going to have information that you're going to be able to use while you're in the clinical site, okay? Now, if you happen to be going this week, don't worry about it. If you get some done before you go, that's okay. If you don't, that's okay too. Just have it done by the next week, okay? Health department. So the health department, we're actually doing a little bit different. So it says WIC, but we're not actually going to be doing the WIC teaching, okay? So Bree's really excited. Bree Greason, she used to work at the hospital. She is now the director over the health department. She's really excited about you guys coming back, okay? So you guys will actually be in groups of 3. When you get there, you will be assigned to one nurse to one-on-one, okay? So one of you will be with the nurse who does like STD testing, vaccines, that kind of stuff. One of you will be with the nurse that does the maternal child, so she does like the OB appointments. And then one of you will be with the nurse that does the WIC assessment, okay? So you'll be assigned a nurse. You'll be there all day. Bree did text me yesterday and said, hey, just let them know we don't open the door till 8:30. So you'll probably be going in with other people waiting to get in. So don't panic when you're like, oh, there's people already here and I'm not here. It's okay. She said, that's fine. So when you get in there at 8:30, just go to the front desk, let them know you're a Seward County student, you're there for clinicals, okay? And they know to expect you. Give Bree's information. So again, if say you wake up at 4 o'clock in the morning, you have a fever, okay? Please contact me, text me, let me know, or Shayla if it's Thursday if you're at the hospital, okay? Besides the hospital, any other place, it's me, okay? Then once it gets closer to time for you to be at that clinical site, you need to call that clinical site and let them know, hey, I'm student so-and-so from Seward County. I was supposed to have clinicals today and I'm sick. I've already let my instructor know. Okay, that way they know they're not going to expect you. Okay, so be there at 8:30. Plan to be there till 4. Okay, please make sure again if you can't go, contact me first and then contact them. So your assignment is you 3 are going to utilize the information you learn from your specific area of the health department, and you're going to create a promotional brochure for the Seward County Health Department. Okay. So I've given you resources to the government website, to the Kansas specific website, okay? Needs to be front and back. This you're gonna have a week and a half, almost 2 weeks to complete. Now there's a couple of you guys that are later in the semester. I'm sorry you're not gonna have as long as the other people because just the way the calendar works, you're gonna have about a week and a half, okay? But that way you have 10 days to then create your little front and back informational guide. Okay, and let us know what is it, how do you apply, what are the benefits that you get from it, just the basic information that you want to tell the population in Seward County about that place. Okay, so there's actually when you click on
Just the WIC or the health department?
the health department, yeah, for each area that you're in. Okay, so it gives you directions. Okay, there's also a website on how to create it. And the main thing is there's some key points, keep it short and concise. And always remember, whenever you create something that you're creating for the open public, you should always do on a lower grade level. Okay, when you're doing your writing. You want it to be explained in a way that everyone can understand. Okay, so don't be wordy. Use simple wording, very understandable. So that way, if someone who only has a 5th grade education and they're 30-something years old, they're not going to be able to understand some of the terms you as a college student may use. Okay, so think about that, and it gives you directions. And when you go to that website for the CDC, it gives you directions. There's several other places tell you how to create a brochure. There's templates in Word. So it's not that hard. It's just putting that information in there, making sure you get good information. What would you as a person going into a new business or experience want to know? Okay, stuff that would draw them to the health department. Okay. Okay, women's health. So you're going to be at 2 places, one of 2 places. You're either going to be at Dr. Knutson's office with Malia Stoll, or you'll be at in Guyman with Megan Furnish. Okay, so here is the outline of who is where when. Okay, there, Hannah, I haven't changed your on here, but I've changed on the other calendar, so I'll get it changed today. As of right now, these are set. I don't have any other things to change. Both places know that you're going to be there. The only thing that could be potential is if we get snow and the office closes for the day or something like that. Okay, and then we'll just have to reassess on what we'll do. Clinical guidelines. Make sure you report to the office Megan's open at 8:30, and plus since you're driving a guy, I mean, I would kind of, you don't have to be there till 9, but a few minutes early is okay. And you're gonna stay till about 3, okay? If they're still going, sometimes with like Dr. K's office, it won't be so bad because you'll be with Malia, but say he goes over for delivery and she gets backed up, by 3:30, if they're still got 10 patients to see, I don't expect you to stay and be there till they get through seeing their 10 patients, okay? As long as you get your 8 hours in, that's all I need from you, okay?
Malia is liberal.
Malia is at Dr. Knutson's office. Yeah. It's in Liberal.
So with Malia, we go in at 9.
Just be there by 9, okay? Make sure,
There's a test.
Before.
Okay.
yeah, there's a little quiz.
Is there anything we have to look, like study before that we take that test?
Just, no, if you want to use your book, you can. But it's just kind of help to kind of gear you to what the things you're going to see or have to, you're going to hear. That way while you're in there, you'll be familiar with what kind of things you're going to see. Because she also sees some of the OB patients and the GAC patients. So, again, make sure every day that you're at a clinical site, you wear your scrubs, your SCC scrubs, black pants, clean shoes. Okay, they don't have to be a specific color. Make sure they're clean, you look presentable, and your badge. You have to have your badge. Okay, that way they can recognize you as not just with your scrubs, but also they know your name. Okay, because if they're like me, it takes them 6-7 months to learn everybody's name. I'm just proud of myself that I know all your names now. Let me tell you, it takes a long time for me. Remember, again, we're guests in the facilities, so make sure you tell them thank you, be courteous, try to do as much as they'll let you do, okay? Again, if you can't be there, call me or text me and let them know also when it gets close to time for them to open. Here are the addresses for both facilities. Okay, so if you're at Malia's, here's the address. If you're at Megan, here's the address, so you can put it in your little Google Maps. Here's the Word document that has all this information in it. So if you want a printed copy so you have it with you, that's fine too. And then your assignments, you have a prep, which is a quiz that you'll take prior to, okay? And then you have your clinical reflection. And Lacey, I did go back and look because after you said something to me, I thought, oh, she said they were the same. So I looked and they were the same. So there is a different worksheet, so I fixed it. So it's just like a quick worksheet with 5 questions that you'll go through and answer regarding that day. Okay, describe the things that you saw occur while you're there in the clinical setting. Okay, and then again, your clinical reflection. Make sure you do that. Okay, and again, here's where you are. Home health. So home health, they have your phone numbers. Okay, so you guys all sent me your cell phone numbers. So home health, they will message you the day before. So probably tomorrow, whoever is scheduled for home health, you'll hear from the nurses there. They'll let you know what time you need to meet and where. Okay, and then sometimes you can ride with them, and then sometimes they may have you follow them. It just depends on the person. Because usually they do drive a company car, and I think if they drive the company car, you can ride with them. Okay. So they'll tell you where to meet, and maybe at the office, it may be somewhere else, depending on where they have to go first. They may not head to the office before they go see their first patient. Okay. There are some reading assignments that are recommended for you to read prior to. Okay. And then you have your home health assignment. This is your focus. And you're looking also on this one, it's good to look ahead because you're actually looking at not just the health of the patient, but you're looking at the home, okay? Because the nurses aren't just looking at the health, they're looking at where do they live? How is their home environment? Is it safe? Okay, so I would suggest you looking at the assignment prior to so you know what you need to be aware of, okay? You need to print it so you can make notes. Then you have another assignment. Again, this will be one you have the 10 days to complete, or the full week to complete. And this just tells you this method assignment is pretty simple, but I would read through, and there's also a little video on how to do it, okay? Okay, family care. Again, with family care, there is a pre-quiz. So you'll either be at the Southwest Medical 15th Street Clinic, or you'll be in Guyman at the McMurray Clinic, okay? And here is the list of where you'll be and when, okay? So you'll be able to look at that and see what location. I tried to put, if people I knew was closer to Guyman, I tried to get you to Guyman. If you lived in Hooker and I had a Guyman person, I put you in Liberal, okay, because you're kind of in between. So I try to get everybody, you know, moved. If, because I do have some free days in Guyman, if you live closer to Guyman, I put you in Liberal, just message me and we can maybe do some moving around if it works with your other clinical schedule, okay? So again, you have your learning outcomes. Here are the addresses. You have your instructions on what to do, what to review. And then here are your assignments down here, okay? So here's your clinical reflection, and there is a specific one for family practice. So I went ahead and put that on there. And then there is a specific one for the OB, which is that longer one, but you'll have your short one too that you do. And here is your quiz that you'll do beforehand. Any questions? Does it all seem laid out pretty easily so you guys can understand? I was trying really hard to kind of make it consistent for each one, make it look the same and give you as much information as I could. So that way you're not thinking, oh my gosh, I need to call Amanda or text Amanda, because it should all be right there if you look, okay? Now I did this over the last couple of days, so there are a few things with the date changes I'll have to go in as far as due dates, because it'll say due Monday in your reading, but it's not going to be. Everything will be due Wednesday or Friday the following week, okay?
My only question is, like, for home health, it does say either at 8:30, so not necessarily.
No, it just will depend on what your nurse tells you.
Okay.
Okay, it says on there, because that's the time that typically you're gonna probably start, but it will all depend on what your nurse tells you when she's gonna start and where.
And then, we're there until when they release us?
Yes, because usually they only do a full 8 hours, like they're with home health. You know, say if she is gonna do an evening visit on someone, that, because that's the plan they've made with that person, I don't expect you to wait and go at 6 o'clock with them. As long as you're done by 3 or 4, you're done, okay? Did you have a question, Lacey?
You go to clinic, are we foreshadowing like the doctors?
Well, so in the family practice, ideally we wanted you with a nurse practitioner, but because it's just really hard to, I mean, we've got a lot of nurse practitioners, but we have contracts with certain places. And so I didn't have another clinic here last semester, or last year I had a pediatric office here with Dr. Yabed that had a nurse practitioner with him. And so I had you at both places because we want you to see what the nurses do, but we also want you in the room when the physician's in there, because we want you to see the process of diagnosing what is the medical problem, what are your signs and symptoms. Because as the nurse, yes, you're going to be that first go-to that's going to ask all those questions. And then we also want to see the physician side too. So you'll kind of be doing both, you know, so stick with the nurse as much as you want as possible. But some places have medical assistants, which is fine because they do a lot of things you as a nurse will do too. But then with the nurse practitioners, if you're with the nurse practitioner, even the physician, and you can be in the room while they're doing their part, I want you to be there too. So either or, just as long as you're getting as much experience as you possibly can. Okay. If you see that the nurse is doing a whole lot more and it's, you know, you're not learning a whole much from being in the room with the physician and the patient, follow the nurse. Okay. You kind of can guide yourself on which you think you're going to learn the most from. Okay. Perioperative. Okay. So this is a brand new assignment. Never done this. So on this one, this is observation only. Okay. So you're not going to do any hands-on this day. Okay. But you're going to be there early. You're going to be there by about 5:45. So that way you're there when the patient gets there. You'll go to the second floor and check in. They'll tell them, you know, you're there for the day. You're going to be following one patient from pre-op, intra-op, post-op. Okay. So they'll show you where the dressing room is and where to get changed. If no one's at the front, just kind of wait around or go. You can actually go through the double door to the pre-op area. And the first day, because you're going to get there a little earlier, you know, you'll kind of have to guide yourself. So go the main elevator to the second floor, get out, you'll be in the waiting room. If you go to the left That's pre-op. You can go through those doors, just find somebody and say, hey, I'm an SCC student. I'm here for the day. I need to put some scrubs on, and they'll direct you where to go. Okay. And then ask the nurses what surgeries are going on today. Okay. Tell them I need to follow someone from beginning to end. Okay. Because at that post-op, they may go home or they may go to the floor. And if they go to the floor, you're going to follow them to the floor. Okay. You're still just doing observation. We're not doing hands-on. And then once that experience is done, so by 2:33, when we're doing our post-clinical, you'll come down with the rest of the group to post-clinical, and then you have a specific assignment for this one. Now, this one, again, is going to be a longer due date. So when you go to your assignment, okay, you're going to actually write a paper, okay, and you have preoperative phase. These are the things I want you to tell me about that preoperative phase. Intraoperative phase, that PACU phase, okay, and then postoperative, like if they go to the floor. Now, if they don't go to the floor and they leave from PACU, then that's where you'll finish, and you'll just let me know the patient was discharged from PACU at this and this time, okay? You have a conclusion, then you get to evaluate how was your day, and then I want it to be an APA format, okay? I'm going to put some resources on how to find some APA format stuff to make it easier on you guys. You guys did very well mostly last semester, but we still got to work on some things, okay? And then here is your grading rubric for the paper. So if you decide to go on and get your bachelor's degree, you will be writing tons and tons and tons and tons of papers. Come on. So the purpose of a rubric in most cases, okay, is going to actually kind of tell you how you can do your best, and then what's going to meet criteria, and then what's going to be below. Okay, so this is going to tell you. So to get full points for grammar, your grammar is correct with no more than 3 errors. Okay. Conclusion, comprehensive information provided for the conclusion. Okay. Address conclusion with basic information, inadequate information. Okay, so if you give me good information, you're going to get full points. If you just kind of basically tell me the basic things and don't really kind of give me much more than that, then you've met expectations, but you're not going to get full points. Okay. So there is your grading rubric. So again, this paper is going to be longer. This is the longest one I think you're going to have all semester, 5 to 7 pages. But as long as you go through and you answer these questions for me, guess what? And it's in good grammar, it's in APA format, you're probably going to get a good grade. Okay. And I do read these. I'm just not as strict on some things as other instructors, but I do read them. Okay.
That assignment is due.
It's going to be due 10 days, 2 weeks. I haven't decided for sure. It says 2 weeks on there, but I've got to look at my calendar again when I start making assignments. So your postpartum preceptor clinical. Okay, this is your Saturdays. I think 1 or 2 of you do have it on a Friday instead of a Saturday. Okay, but most people have a Saturday. Here's the information you need for that. So again, if you're not going to be able to make it, you'll need to call the OB floor and let them know. You'll need to let me know. Okay. So you have a quick reflection, little blurb telling me how your day was. Okay. It is 12 hours. You're going to be there from 6:40 till 7. Okay. Once you give report on your patient, then you can go. You may get to follow the nurse and see lots of patients. Okay. But your main thing is I want you to focus on postpartum newborn if you can. But if you can see labors, you can see C-sections, that's okay too. I'm really big on you getting exposed to as much as you possibly can. So you'll have your clinical reflection that is due. That's that short one. Okay. You have 3 forms that you need to print and take with you. 1, you're going to give to your preceptor. I'm going to bring envelopes and leave them in here this afternoon. So tomorrow you can grab an envelope to have. Your preceptor needs to fill that feedback form out on you and put it in the envelope and seal it. And then you bring it back to me on Monday. I'm gonna put that it's due by 3 p.m. because you'll bring it to me in class. That way you don't freak out because you didn't see her that morning and you're like, oh my gosh, I brought it, but it was after 8:30. It's okay. Okay, you'll have that day to get it to me. Your student feedback form about your nurse and your time log, you will upload to the assignment. Oh, I lied. You do have another paper. This one does not have to be as long. It's only 1 to 2 pages. Okay, very basic. It's basically just telling me what you did. It's a longer clinical reflection, basically. Okay, how was your experience? How did you feel about the day? And it gives you the things you need to tell me. Okay, right here. Here's your clinical objectives that you should meet that day, but this is all I need to know. It only has to be 1.5 pages to 2 pages long. Okay, very short. Still APA format, but does not have to be super long. Okay. Wound care is on here twice. Disregard. I'll take one of those off. So simulation days, you'll notice has nothing in there yet. Okay. And the reason is because Janessa hasn't put anything in there yet. She's creating the day, so there will be a group of you that will actually get to do it with me because she'll be out on maternity leave, but she'll be the one that sets up what we'll do that day. And basically, it's kind of be a comprehensive simulation over, you know, what we're going to learn this semester and maybe what you've already learned. Okay, so it's going to be, you know, either child or an adult, either one. Okay. I don't know. It's up to her. She may have several simulations where we kind of have simulation stations where we go through and we assess a child and then we assess adults, or, you know, I don't know exactly what she has planned. Okay. So any questions? Okay. Again, most of your information should be in here. I'm reviewing these again this afternoon. I was just trying to get everything on before we started. Okay. If something looks different and you're like, okay, Amanda said that, you know, my care plan's not due till Wednesday. It's not due till Wednesday. Even if it says something different, I'm going to try to get those fixed this afternoon. It's not due till Wednesday. Most of your big things are going to be due, like your wound care stuff's not going to be due till Friday, the following Friday. And then of course your long paper, you'll have longer time to get done. Okay. Do y'all feel less overwhelmed with your work so far this semester since we've done a lot in class? I know the first 2 weeks were kind of overwhelming because it was a lot of content, but I've been really trying hard to give you as much time as possible when we're here, but also to cut down on the amount. Y'all feel a little better about it this semester?
Yeah, definitely.
Okay, so I'm trying really hard.
Yeah, thank you.
So again, with your clinical experiences, you know, unfortunately in healthcare right now, we're short-staffed on the nurses. With every facility, it's not just Southwest Med. And so sometimes you may see frustration, you may see shortness. Okay, don't take it personally. Okay, it's just the nature of the beast right now. Okay, look past that, because hopefully with this Omicron, nobody likes getting COVID, but what they're seeing with the research with Omicron is they really think this is going to end the pandemic. Very highly contagious. Lots of people are getting it. The majority of people who get it are having mild symptoms. There are still people being hospitalized, but they're also seeing that because it is more virulent, people are getting exposed and getting it, is that now we have more people who are going to have antibodies. Okay. And so, you know, several big scientists, even Dr. Fauci has said, by this time next year, COVID will be more of like a seasonal type virus, like the flu, instead of all year round. Okay. And it is because, you know, we're getting to the point where more people are being exposed, having it multiple times, and those antibodies are building up. So I was going to, we still probably will do fit testing. I just don't know when yet. So I had some assigned people to do at least one day in the COVID unit, I don't know if we'll do it yet because I've got to get you fit tested. You can't go in until you're truly fit tested. Some of you are because you work at the hospital and you know what size you wear, but we'll have to do it again since you're a student. And so I just got to get that scheduled with Elizabeth. So until we have that done, you won't be able to go into COVID rooms, okay? Until we know exactly what size of mask you need for fit testing.
Even the days we're in ER, we cannot go into COVID rooms.
There's going to be times that you may be in a room and then find out they're positive, okay? And so, because that happens all the time. Yeah, all the time. But just be aware, be conscious when you're in the ER. You know, if you have to wear a hospital supplied mask while you're in the clinical setting, okay? So you can wear, when you go into the door to check in and they check your temperature, grab a mask from there. If you're in the ER and you find out a person's COVID positive and we haven't gotten fit tested, just stay out of the room from that point on, okay? I mean, I know you guys, a lot of you work in healthcare, a lot of you are exposed, you're going to Walmart, you're being exposed, you're sitting in the classroom, you're being exposed, you're going to church, you're being exposed, you know, it's happening, I understand that. But again, I'm trying to keep you guys healthy because you're in nursing school and you don't want to miss too much, okay? So, any other questions? Okay, guess what? We're done. You're going home today. Are you excited? Okay, so tomorrow Janessa will lecture. Okay, I'll leave the classroom open if some of you guys want to stay and work or study or whatever. Okay, I'm gonna go. The first thing I'm gonna do when I get in my office is I'm gonna put up some times for meetings. Okay, and that way, some of you I may be contacting to meet with me since we're at the second test. If you need to meet with me because you're concerned about something, go on there, look at the times. Okay. Otherwise, I will be in my office if you have a question before you leave.
About the ATI tomorrow.
Tomorrow.
About it.
Yep, and she changed the due date. I think she even sent out a message to send on this. I think is what Carolina said.
Yep.
So, yeah, that'll be in class, something you're doing tomorrow. Okay.
And we're not worried about the assignments on the calendar for today.
If it says in class due today, like it's an in-class assignment she has scheduled for today, no, it'll be due tomorrow when she does her lecture tomorrow.
And the PowerPoint that was for today,